Do a 360.
Come in.
Hi, my name is Lesley. I'm going to be your nurse today.
Okay.
All right, can I see your wristband, please? Can you verify name and date of birth?
Grace Edwards, 5/16/1995.
All right, perfect. I'm going to go ahead and perform hand hygiene and then close the door for privacy. So do you know where you're at today?
Yes, at the hospital for a health assessment.
Okay. Do you know what the date is?
July 2024.
All right, so patient is alert and oriented to time, situation, and place. All right, so patient is of small stature, mood is cooperative, speech is clear and articulate, and patient is well kept. All right, so I just have some questions for you.
Okay.
All right, so do you have a history of skin disease?
No.
All right, do you have any itching?
No.
Any bruising?
No.
Have you noticed any lesions?
No.
All right, are you exposed to any occupational hazards?
No.
All right, perfect. All right, so I'm going to go ahead and begin with the physical part of this assessment, okay? If you can put your arms out for me. All right. And then put your arms out to the sides for me. Perfect. All right, so patient's skin is warm and dry. Skin color is consistent with genetic background. All right, no tinting present. Okay, so I'm going to go ahead and do the heart assessment, okay?
Okay.
All right, so just some questions for you. So do you have any chest pain right now?
No.
Any heart disease?
No.
Any family history of heart disease?
No.
Okay, how many pillows do you sleep with at night?
Just one.
Any chest pain?
No.
Okay. And any recent waking?
No.
Any swelling to the lower extremities?
No.
Okay, perfect. I'm going to go ahead and have you turn over to the side, okay? I'm going to check for jugular vein distension. So I place you at 30 degrees. All right, and if you can look away for me, and then look towards me, and then towards me. Okay, and then look back that direction. All right, and go ahead and sit up for me. Thank you. All right, so no JVDs noted. All right, so next I'm going to assess your carotid pulse, okay? All right, so carotid pulse is of moderate strength, and carotid arteries are smooth. Okay. I'm going to go ahead and listen to them, okay? I'm assessing for bruise. Okay, go ahead and hold your breath for me. All right, take a breath. All right, hold your breath. Okay, perfect. Okay, so next I'm going to go ahead and listen to heart sounds, okay?
Okay.
Okay. All right, so it's going to be, so the aortic, it's going to be the second intercostal space, right sternal border, pulmonic, second intercostal space, right border, herbs, third intercostal space, right sternal border, tricuspid, fourth intercostal space, right sternal border, and then mitral, it's going to be fifth intercostal space, midclavicular. Okay, and then I'm going to change my diaphragm around so I'm on the bell side. Okay, and then I'm going to listen for your aortic. So I would listen for 30 seconds. So the 30-second pulse is 35, so times 2 would be 70. Okay, so next I'm going to go ahead and do your lung and thorax screening. All right, so do you have any shortness of breath?
No.
Any history of lung disease?
No.
How many pillows do you sleep with at night?
Just one.
Do you have a history of upper or lower respiratory infections?
No.
And then do you smoke?
No.
Okay, so I'm going to go ahead and inspect. Right, so skin is consistent with genetic backgrounds. Posture is upright and relaxed. Shoulders are symmetrical. All right. No bulges or retractions in the intercostal spaces. AP ratios 2:1. Respirations are automatic, regular, and even. Okay, so I'm going to go ahead and palpate, okay? Let me know if there's any tenderness. Any tenderness?
No.
All right, so patient denies tenderness and no crepitus. When you feel the backs of my hands placed against you, I just need you to say blue moon, okay?
Okay.
All right.
Blue moon, blue moon, blue moon, blue moon.
All right, so tactile fermetus is present equally bilaterally. All right, next I'm going to palpate. I'm going to percuss. All right. All right, so resonance predominates in all lung fields. All right, and then next I'm going to auscultate, okay?
Okay.
So for this one, I'm just going to have you take slow, deep breaths in and out through your mouth, okay? All right. Okay, and then can you turn around for me, please?
Yes.
All right, so same thing again. All right, so for inspection, patient's skin is consistent with genetic background. No skin lesions or masses noted. Posture is upright. Shoulders are symmetrical. All right, come around this way. All right, so can you go ahead and take a deep breath in for me? All right, so chest expands equally bilaterally. I'm going to go ahead and palpate, okay? Let me know if there's any tenderness. Any tenderness?
No.
Okay, no crepitus present. I'm going to put my hands on your back. Just go ahead and say blue moon for me again, okay? Okay?
Blue moon, blue moon, blue moon, blue moon, blue moon.
Okay. Tactile fermetus equal and present bilaterally. All right, so next I'm going to palpate, okay? All right, timpani predominates, resonance predominates in all lung fields. All right, and then I'm going to go ahead and take a listen, okay? So it'll be the same thing, just deep breaths, slow deep breaths in and out through your mouth. Okay, ready? Go ahead. All right, and so while I was back here, I would go ahead and count respirations while the patient was unaware. So respirations would be 16 for 1 minute. Okay. So next I'm going to have you go ahead and turn and lay back down again how we were.
Lay flat.
Yeah. All right, I'm going to go ahead and do the peripheral assessment, okay?
Okay.
All right. So have you noticed any itching or any lesions or skin changes to your arms or legs?
No.
Okay. Have you had any cramping in your legs?
No.
How about any pain?
No.
Okay, perfect. All right. So can you go ahead and hold your arms out for me? All right. So I'm going to just assess your pulses, okay?
Okay.
All right. So I'm going to do your radial pulse, ulnar pulse, brachial pulse. I'm going to come down. So the femoral would be in the inguinal area. All right, and then go ahead and turn this a little bit. All right, I'm going to go ahead and do the popliteal. All right, and then dorsalis pelvis will be on the tops of the feet. All right, and then posterior tibialis. All right, next I'm going to go ahead and take your radial pulse. Can I see your arm? All right. So I'm going to do it for 30 seconds. right, so the 30-second radial pulse would be 30 times 2 would be 60. All right, and next I'm going to check for cap refill, okay? See your other finger? Cap refill in fingers is under 3 seconds. Next I would check the toes. Okay. Cap refill is less than 3 seconds. All right, so next I'm going to check for pitting edema. I'm going to lift this up, okay?
Okay.
All right, so I'm going to push down for 5 seconds. All right, no pitting edema noted. And then I would do the tops of the feet for 5 seconds. All right, no pitting edema noted. Okay, I'm going to go ahead and turn this back around. All right, so last I'm going to do the abdominal assessment, okay? All right, so have you noticed any cramping?
No.
Have you had any nausea or diarrhea?
No.
Any vomiting?
No.
Do you have a history of abdominal surgeries?
No.
In your last bowel movement?
Today.
Okay, perfect. All right, so I am going to go ahead and take a listen. All right. You see it? Yeah. Okay, so patient has normal active bowel sounds in all 4 quadrants. Next I'm going to progress, okay? Let me know if there's any tenderness. I'm going to do 3 areas per quadrant. All right, tympany predominates in all 4 quadrants. Next I'm going to palpate, okay? Let me know if there's any tenderness. So I'm just going to go in a little bit at like a centimeter. All right, and then I'm going to go in for both, okay? I'd be going in about 3 to 5 centimeters. Any tenderness?
No.
Right, so no masses. Patient denies tenderness and no organomegaly. And I would normally have exposed the entire chest. Is it okay if I go ahead and expose?
Sure.
So I would pull this up to the lower chest and I would bring the pants down to the pubic symphysis. So skin's color is consistent with genetic background. No lesions or no abnormalities noted. All right. All right, so that's all I have for your health assessment. Do you have any questions for me?
No.
All right, go ahead and sit you out. All right, and here's your call light, so call me if you have any questions.
Okay,
All right.
thank you.
Thank you.